Dr. Jeffrey Cly, HonestOBGyn.com. What surgery can stop your period? So you've done the other stuff and you keep bleeding and it's driving you crazy. We're not talking about a hysterectomy. So we're talking about a DNC and uterine endometrial ablation, which means that it's a procedure to seal the blood vessels inside the middle of your uterus. There's different ways to do this. It typically works very well for specific people. And so the blood vessels are sealed and they're either cauterized with electricity or hot water, and they will no longer produce that endometrial lining or bleed, and you can no longer get pregnant after this. The one type that's out right now is called the Genesis, and it uses hot water, and it's got some of the best data that I've heard to last the longest, be the most effective, treat all of the uterus, and it is okay for women with any size uterus. The other two types that are out are NovaSure and the Minerva. They use cautery. They work very well. They work differently. They are very quick and sometimes can be done in the office. Talk with your doctor about the different types of uterine endometrial ablations, and if that's something that you think fits and will help you not have to do a hysterectomy and stop your bleeding, then that might be a really good solution for you. One word of caution: the younger you are, the more likely your uterus will try to start bleeding again before menopause. Menopause at age 50. So if you're in your 40s, an ablation can be a great solution. If you're in your 30s, it can be a great solution, but it may not last until you hit 50. That's just something I find that many women are told, that it may not last forever when they're young, and then they come back. And if you start bleeding again later, the Genesis is the only one that can be done again, but the other types would require that you would have to have a hysterectomy if you start bleeding again. So it's a great solution, especially in your 40s, maybe in your 30s, and it's minimally invasive. You're home the same day. You get back to your life so fast, so quickly. It's a uterine endometrial ablation. Talk to your doctor about it if you want something to stop your heavy bleeding and not have a hysterectomy. Dr. Jeffrey Cly, HonestOBGyn.